Hey there and welcome. If you're an international healthcare professional, you know that one of the most common tests you'll talk about is the blood count. So today, we're going to build your confidence in doing just that, clearly and accurately in English. Just think about it for a second. You see the results, you totally get the clinical significance, but how do you turn that knowledge into simple, reassuring words for your patient? It's a challenge we face every single day, and that's exactly what we're here to tackle together. Okay, let's dive in. First, we'll start with the basics, what a blood count actually is. Then, we're going to build your vocabulary with 5 essential terms and nail the pronunciation. After that, we'll put it all into practice by learning how to talk to patients. And finally, we'll polish your skills by looking at a few common mistakes to avoid. Sound good? It's a clear roadmap to better communication. And hey, just a quick heads up, if you want to review any of this later, you can find a link to the full transcript and a short quiz down in the description. It's a really great way to practice. All right, let's pick things off with our foundation. You know, really understanding the basics is the key to explaining anything well. So, what is a full blood count, or an FBC? Well, it's one of the most common blood tests for a reason. It measures all the different types of cells in the blood, which gives us this powerful snapshot of a patient's health. I mean, with this one test, we can check for infections, diagnose anemia, monitor conditions, and even see how someone's body is responding to a new medicine. It's incredibly useful. Now that we've got the basics down, let's build our clinical vocabulary. Honestly, mastering these next 5 terms is going to make a huge difference in your daily conversations, both with colleagues and with your patients. Our first term is leukocyte. Now, listen carefully to the pronunciation. Leukocyte. Let's try it again. Leukocyte. See how the stress is on that first syllable, leu? These are the white blood cells, basically the soldiers of our immune system. So, how does that sound in context? Well, you might say, a high leukocyte count often suggests a bacterial infection. Or, the lab report shows a normal range for leukocytes. Okay, next up we have erythrocyte. The pronunciation here is erythrocyte. Let's say that one more time. Erythrocyte. The stress is on that second syllable, rith. This is just the technical term for a red blood cell. You know, the guys responsible for carrying oxygen all through our bodies. And here are a couple of examples for you. The patient's erythrocyte count is low, which indicates anemia, and the test measures the average size of the erythrocytes. Term number 3 is platelet. Now, this one's probably more familiar. The pronunciation is pretty straightforward. Platelet. Again, platelet. These tiny little cell fragments are absolutely crucial for helping our blood to clot whenever we get a cut or an injury. In a sentence, you might hear something like a low platelet count or thrombocytopenia can cause easy bruising. Or in a hospital setting, we need to monitor the platelet level carefully before the procedure. All right, now for a very, very common condition, anemia. The pronunciation is anemia. One more time, anemia. So this is a condition where there just aren't enough healthy red blood cells to carry the oxygen the body needs. So let's put that in context. You might say, the blood test confirmed the diagnosis of iron deficiency anemia, or when talking with a patient, common symptoms of anemia include fatigue and weakness. And our final key term can be a tricky one to say, so let's break it down. Hemoglobin. Really stress that first syllable. Let's try it again. Hemoglobin. This is that super important protein inside the red blood cells that actually grabs onto and transports the oxygen. And in a clinical setting, you'll hear her hemoglobin level is below the normal range for an adult female. Or maybe we are checking the hemoglobin to assess for any internal bleeding. Great work. Now that we have the technical terms down, let's focus on what might be the most important part, patient communication. This is where we learn to translate all our knowledge into language that is clear, simple, and of course, empathetic. This is where the magic really happens. Look at these simple ways we can bridge the gap. Instead of saying leukocyte, we say white blood cell. And you can even add a simple analogy, like these are your fighter cells. So much clearer. Instead of just saying anemia, explain what it feels like. This means you have a low number of red blood cells, which is probably why you're feeling so tired. For platelet, that image of tiny plugs to stop bleeding is perfect. And for hemoglobin, explaining it as the part that holds onto oxygen makes a really abstract concept easy to grasp.
Okay, for our final section, let's go over a few common mistakes. Fixing these little things will help you sound more professional and make sure your communication is always spot on.
First up, let's try to avoid using technical jargon with patients. I mean, saying you have leukocytosis can sound pretty scary and confusing, right? A much better way is to translate it. Your test shows a high white blood cell count, and then explain what that means. This usually means your body is fighting an infection. It's so much clearer, more informative, and way more reassuring. The second common mistake is incorrect word stress. Now, this one is subtle, but it's so important for clear communication, especially with your colleagues. For example, saying platelet with the stress on the wrong syllable might just cause a moment of confusion. The correct way, as we practiced, is platelet with the stress right at the beginning. Getting the stress right just makes you so much easier to understand. And finally, try to avoid overly informal shorthand. Now, you'll probably hear people say your white bloods are high, but it isn't very precise. The correct and more professional phrase is your white blood cell count is high. It's just a little change that really elevates your professional communication. So, as we wrap up, I've got a question for you. Based on everything we've covered today, what is one small change you can make, starting right now, to communicate more clearly about blood tests? Maybe it's practicing the pronunciation of erythrocyte, or maybe it's using that fighter cell analogy with your next patient. Thank you so much for joining me for this explainer. If you want to keep building clear and confident medical English, please feel free to explore the Medical English collection at the link on your screen. Keep up the amazing work you're doing.